Hello and welcome. Today we bring you Dr. Ahemd Elsaid Ali. Ahmed, welcome.
Welcome, Dr. Kashim.
Dr. Ali is going to Elsaid Ali is going to show us on how to do a Prospero submission for a systematic review or meta-analysis. He will share his screen and then walk us through in next 10 to 15 minutes how you can have a successful Prospero submission. Ahmed, take it away.
Okay, thank you so much. So we're going to talk about the PROSPERO registration for systematic review and meta-analysis. And this is a vital step in the process of publishing your manuscript because it eliminates the possibility of bias that may happen later during the whole process. So we're gonna view it quickly. So the first thing is your review title, which needs to be accurately described the title of your manuscript. Actually, this is my submission in some time during the last year. So this is should be like this. It should contain your PICO, which means population, intervention, comparison, and outcome. And actually, we're gonna go over it in later questions after this. This field is for manuscripts that weren't in English, so we're gonna skip this. This is the dates that you anticipate to do your manuscript and finish it by this time. Actually, it's not mandatory. It's a provisional one. You need to submit it like only for submission. You don't need to stick to these dates. And here, these are the steps of your systematic review and meta-analysis. You need, at least you need to do your submission before this step, before data extraction and data screening. Which means that once you have defined your PICO, you have defined your research questions, you can even define your search terms and keywords. And after this, you need to do submission not later than this, because after this, you will start the process of data screening and the data extraction, and the bias could happen in this step. So this is only personal information for the first authors that submit the manuscript. The organization affiliation. Here are the team for the manuscript, the author and the co-authors. For each one, sorry, you need to submit your name, your institution, your email, your country, all of these things. Here, if you have any form of funding, you need to disclose it. If you have a grant or something, conflict of interest, those are for all kind of papers. Okay, this is the most important part. Here you need to define your review question, and even you can divide it into 1, 2, or even more questions, which means what are you really investigating? What's your outcome for this submission? After this, here are the databases that you will go over for your data. Like here, we have screened articles from 3 different databases, which were PubMed, Scopus, and Science Direct. You need to define exactly which dates you are using these data. For this case, as an example, it was from January 2017 to August 2022. After this, if you put any restrictions for your articles, you need to put it right here. Okay. Here you can submit a link or even a Word file for your search strategy, which means your keywords and your that you used for every database to extract the articles from it. This part is concerning the PICO population. So here is the condition at which you are being investigated in your manuscript. For our case, it was heart failure. Your population, you need to define it clearly You need to put the age of participants, what will be their characteristics, if they have disease, which criteria you will use to define this population. After this, your intervention and control. In our case, we're investigating a specific drug, which was dapagliflozin, and our comparator was placebo or standard therapy. Here, your inclusion and exclusion criteria. For an example, you could you may be investigating some form of randomized controlled trials. You may do some cohort studies, even case series and case reports. All of this should be lined here. The context, it's more like the introduction section for the manuscript, but it's simpler than this, which means 1 or 2 sentences. You already, like, you explain to them why are you wanting to investigate this particular topic. Okay. After this, your outcomes. It can be main outcome and some other outcomes. The main outcome for this case was, as you see here, clinical mortality, worsening heart failure, etc. You can define anything, but probably or it should be like 2 or 3 outcomes, because any other outcome after this you could put here, right here, and the additional outcomes. This is measure of effect, which means which tests and which variables you will use to identify your data, to identify the outcome for your data. As an example, for here, we're using relative risk, odds ratio, or hazard ratio. You could line anything you want according to your data. It may change it from one topic to another. Data extraction. This is like 3 or 4 sentences at which you explain to them how you're gonna do the data extraction. As an example here, we said the studies will be exported from these kind of databases. We use Ryan software for data screening and and then 2 independent authors will screen every article. Any conflict will be resolved with another author. All of these things should be aligned here. And then regarding your data extraction, we used Excel sheets and we extract data to it. After this, before we're doing analysis using the Ryan software. So all of this should be aligned in this section regarding data extraction. After this, the risk of bias assessment. There is so many tools that you could use for risk of bias assessment, and it differs from according to the type of your systematic review. As an example, for here, we're doing systematic review for randomized controlled trials. So we used modified Cochrane risk of bias assessment tool, and there is other similar tools like simpler than this, but we use this anyway in our manuscript. So here, just like the previous step, you will explain it in particular that we will use this tool, and this tool contains this variables, and it will differ according to the type of your manuscript, your systematic review. Here, the strategy for data synthesis, which is how you're gonna analyze your data after data extraction. You're gonna, let's say we have 9, 10 articles that we will include in our meta-analysis. Then when you analyze these data, how will you do this? So for as an example, for our case, we used the Rayman software, and we used the relative risk, as we mentioned in before this. We used mean difference and 95% confidence interval, which statistical tests you're gonna use, and how you're gonna evaluate your heterogeneity. And even you can mention here also, if you have heterogeneity in your result after analysis, how you're gonna face this problem. After this, if you intend to do any form of sub-analysis, you can put it here. In our example, we said that We may do an analysis according to patient age and diabetic patients. It could be anything. This is the type of method review, meta-analysis, the area, language, country. I think this is all. Any other thing, your keywords, you can put it here also as well. And that's it.
Thank you so much, Ahmed. This was really short, crisp, but very highly powerful. You can unshare your screen now if you want to. One of the things I would ask you that as you were doing because this is your first time doing it as well, what was
Yeah.
the most challenging part when you were filling the Prospero submission when you were doing it, or did you struggle with the one part more often than
Yeah.
anything else?
Yeah, I think the part was data extraction and the strategy for data analysis. That was the most difficult part because you need to go over other forms of meta-analysis. You need to get familiar with the test that they are using and choose which test would be appropriate for your data, because it will differ according to your data with whether you're dealing with continuous variables or other kind of variables. So I think this was the most difficult part.
Any advice you will give it to the novice researcher or new researcher when they start the Prospero submission? What is the one thing you want, one or two things you want them to be careful enough as they fill it?
I would recommend that try to be as comprehensive as possible when you submit your Prospero submission, because every change you will need to do after this, you need to submit a request for it, and it may be like an indicator of some form of bias. If you change anything, as an example, if you change one of your outcomes, this means that you during the process of manuscript, you found out that it's not gonna work like this. So you add something or delete something, maybe a source of bias. So just
That,
try to be comprehensive as much as possible.
that's a very good advice. Well, thank you so much for being here today with us. And this is very helpful for those who are watching it. Please like and subscribe to our channel, and then we'll keep bringing such resources for you as well. Dr. Ahemd Elsaid Ali, thank you so much for being here with us today.
Thank you so much for everything. Thank you, and I wish everyone who could watch this video could benefit from it by somehow, and we're gonna be useful for them.
Absolutely. Thank you.